men and women, young and old, and healthy and sick. And I'm also a scientist who studies blood vessels. And blood vessels and what they do actually lead to those signs in your legs and feet that tell you if you got a heart problem. So I'm an expert on circulation, and what I'm going to tell you today will help you pay attention to what's going on in your legs when it comes to your circulation. Now, your blood vessels bring oxygen and nutrients, and all the oxygen that you breathe and nutrients that you eat right to the cells, muscles, tendon, and bone in your legs and in your feet. When those blood vessels are working well, you're actually going to be able to walk around and run and do all the things that you normally do in life without a problem. When those blood vessels have a problem, one of the common problems is that they get blocked up with atherosclerotic plaque. They narrow down. Now think about it. It's like a drinking straw that you cut in half. What's going to happen? You're not going to get as much fluid in it, just like if you had a half the size of a drinking straw. Same amount of sucking up the liquid, it's going to be a lot harder and you're going to get a lot less. Now, that's frustrating when you're actually drinking out of a small, thin straw, but it's actually terrible when it actually happens in the legs. When your legs don't get enough blood flow because your blood vessels are narrowed, then you actually have a crisis in your legs, right? Because your muscles, when they're contracting, need oxygen and they also need energy. They need glucose. They also need all the other things that are actually happening that your blood is carrying. So what happens when there's a compromise? Well, a sign that something's going on with your legs and feet is when you've got cramping. Now, we've all had cramping before, but I'm talking about the cramping where you just walk like 100 yards and all of a sudden you can't walk anymore, like you've got this terrible cramp. And it can get worse and worse where you then walk even 100 feet. Or if you were in a shopping center from, one part of the store to the next, you can't actually continue because you get terrible muscle cramping. That's actually not normal. That's a warning sign that you're having blood flow problems right in your legs. Without enough blood flow, your muscles cramp up, all right? And you got to stop. So cramping is one of those warning signs, telltale warning signs that there is something actually going on because your muscles are carrying around your frame. They do a lot of work. And then when you're actually walking around, they consume a lot of energy. And if they're not getting that energy, they're not getting that oxygen, they're going to seize up and you're going to actually have a cramp. Now, this is the condition that's called peripheral arterial disease. Peripheral because it's not central in your body, all right? It's sort of in your periphery. Your legs are considered the periphery, your legs and feet for sure. Peripheral arterial, so this means that the arteries are getting narrowed, right? And disease, obviously. PAD is what we call it, peripheral arterial disease. If you were in England, they call it PAOD, peripheral arterial occlusive disease. Occlusive means it's actually getting very, very narrow. And this is actually a problem that I know about because what you really want to do is to stimulate new blood flow in order to be able to grow around the blockage, to restore blood flow. Right now, what happens if you have this type of cramping, a surgeon, a vascular surgeon, will do all the studies to define exactly where the blockages are. And they can take a catheter through your groin and stick a balloon all the way down into where the blockage is and blow the balloon up, press the plaque out or just actually rotor-rooter out the blockage and put a stent in. Okay, this is like a wire basket that pops open and pops that blood vessel open where it was narrowed. And now you've got blood flow again. So you can actually solve this problem of peripheral arterial disease with a stent or angioplasty, which is actually where you blow up the balloon to be able to open up the blood vessels. Now, listen, this is not a local problem. People with peripheral arterial disease have a systemic problem. So it's narrowing of the blood vessels everywhere. These are the people that have narrowed the blood vessels in their organs, in their brains. So they can also have basically narrowing of the brain blood vessels, and that can lead to cognitive issues, memory problems, and in fact, ultimately vascular dementia. Vascular dementia is much more common in Alzheimer's disease. It's actually something that we see as blood vessels get hardened, okay? So now we learn about one warning sign that is actually cramping in your leg. Now, a warning sign number 2 that you should be aware of is when you actually have a wound on your feet that doesn't heal. Now look, most people, if you cut your feet on something, like step on a piece of glass, step on a nail, hopefully you had your tetanus shot, but let's say you cut yourself, what's going to happen? First, you're going to react in pain, ouch, pull your feet back, and then you're going to lift your foot up, okay? And you're going to see if it's bleeding. And if it's bleeding, you're going to rinse it off. You're going to wash off all the bacteria that might be on there. Could have put a bandage on it, right? And basically, as long as you keep that clean and it's not too deep and you've removed all the foreign material that's there, which is why you want to really wash it off well, that wound will heal up. I mean, it starts to heal as soon as it forms, but by a week to 10 days, your wound will actually do pretty well. The foot, the bottom of the foot especially, is a very dirty part of our body because it's in contact with the ground or the inside of your shoe. You know, we wear shoes so we don't actually get our feet dirty, but you know how dirty the inside of a shoe is? Nasty. Inside of an old tennis shoe or, you know, an old pair of work shoes that you're actually wearing every single day, not good. So if you're going to actually cut your foot, normally, wash it off, put a Band-Aid on. You might want to put a sock on before you slip it into a shoe. And a lot of people say, well, I'll just walk around in flip-flops. Well, be careful because then the bottom of your foot's exposed to everything. So put a bandage on, check it, change that Band-Aid after a day or so. And when you take a shower, take a little bit of soap and clean off the cut area as well. Believe me, if it's normal, a cut on your foot will actually heal up. But that's not the warning sign. The warning sign is actually when the wound that's on the bottom of your foot doesn't heal. In other words, the wound, you get a cut. The cut may not even be painful, but it's there and it stays there more than a few days, more than a week. It's there 2 weeks later. What? It's not healing yet. It's 3 days later, still not healing. A lot of people don't even know that they actually have a foot wound, particularly if they've got diabetes, because the nerves in some conditions like diabetes are dying back. If you don't have enough nerves in your foot, you're not going to feel when you actually cut your foot, right? Now, those nerves are dying back because the blood vessels that support the nerves are damaged. This is one of the issues with diabetes. You've got a diabetic neuropathy, which is actually a problem of the nerves dying back. So diabetics have difficulty feeling the soles of their feet. Very easy to step on a piece of glass, all right, and be cut, and you don't even feel it, all right? Now, one of the reasons that the nerves are dying back is that the blood vessels feeding the nerves are insufficient or they're blocked out, all right? So every nerve has its own blood supply feeding it. It makes a lot of sense, right? You got a telephone line that's going from pole to pole along the highway. You're going to have a support line going along with it, and those blood vessels are the support lines bringing oxygen and nutrients to the nerve along its entire journey on the bottom of your foot. Now, I told you that in diabetes, there's blood vessel problems, and those blood vessels feeding the nerves are not normal. They're dying back, and now without oxygen and nutrients, the nerves die back. And now you have an understanding of what diabetic neuropathy actually is. Problems of the nerves start with problems of blood vessels, and that's an area that I study. So that's why I'm going to give you this level of detail. Now, when you cut yourself, you need blood vessels to grow back. That's a process called angiogenesis. Angio, blood vessels, genesis, how they grow. And this is actually very, very important from your entire life, that your body is able to use this process of angiogenesis, one of the health defense systems, to make sure that all the tissues in your body have the right amount of blood at all times, all right? And you got to get the right amount of blood flow. So in diabetes, you wind up having damaged blood vessels. At the lining of the blood vessels, the endothelium is what we call it, is damaged, all right? And when that's damaged, the blood vessels actually more easily clog up, okay, and also clot. And when you have those ever narrowing blood vessels, that happens in diabetes. When those are the blood vessels that follow the nerves and support the nerves, when those blood vessels go, guess what? The nerves go. So diabetic neuropathy, diseases of the nerves, are partly caused by diabetic vasculopathy, meaning that diabetes causes a problem in the health of the blood vessels. Bad blood vessels to nerves, bad nerves, right? So this is what actually happens in the feet of people with diabetes. So they don't even feel it when they step on a nail, when they step on a tin can, when they step on a piece of glass. And that cut that occurs, actually, you can be dragging it around for a long time if you're not checking the bottom of your feet. If you don't feel a pain, remember I told you, normally you step on something, you cut yourself, boom, you pull your leg back and you go check your foot. That's the natural instinct. But if you don't feel it, you're just going to, after the cut, you're going to just slide your foot back into your barefoot back into the shoe and tool around. And you might not even know that you actually had a cut. And in fact, some people with diabetes winding up having these foot wounds don't even know that there's an injury until days later, maybe weeks later. They start smelling something really foul coming from their body, and it turns out to be coming from their foot because now they've got rotten tissue. That wound has not healed, and that's the warning sign, a chronic wound that doesn't heal. This is actually something that's pretty common, unfortunately, in diabetes, and also it can also happen with peripheral arterial disease. But it's kind of a silent epidemic. People don't like to talk about holes on the bottom of the feet that aren't healing. And doctors actually don't know. Most doctors don't know how to actually handle a diabetic foot ulcer. Now, I happen to be one of the people who've led the charge, both research, treatment, policy wise, to figure out how to actually heal these chronic wounds. Because you know what happens if you don't heal that chronic wound? Unfortunately, that wound will get deeper and deeper because it's not healing. The bacteria will kind of get in there, and it'll start oozing pus. All right, and then the tissue will start to die in that area, and eventually you could actually get an abscess. The bacteria can get into your bloodstream. You can get septic. And by the time many patients actually wind up going to their doctor, and their doctor goes, hey, I don't know what to do with that. Finally, the patient gets referred to a wound clinic. All right, there are several hundred wound clinics around the country, not enough of them by any means compared to the number of people with diabetes. And those special wound clinics have trained staff and experts, clinical experts, that know how to actually apply advanced technologies to be able to start healing that wound. If you don't go to the doctor, all right, you're going to be walking around with basically a rotting piece of your foot that's going to get worse and worse. And when that rot continues to go bad, you can get gangrene. So the treatment for diabetic foot ulcers, when it's detected early on, we'll clean out the wound, we'll maybe even cut out the non-healing wound to kind of get a fresh margin. And then there's all kinds of different tricks of the trade that can be applied that actually work really well. Everything from putting a living skin equivalent, it's kind of like a living bandage on it to help heal. There's a growth factor. It's like it's called Regranix Bicaplermin. It comes like in a small tube, like a travel tube of toothpaste. You squeeze some on there. It's a protein that stimulates angiogenesis. So it stimulates healing that's already way too slow in the diabetic foot, somebody with diabetes. So just go ahead and stimulate it. And in fact, this growth factor gel, the thing that comes in a toothpaste called Bicaplermin, was FDA approved because clinical trials showed that it actually sped up the rate of wound healing. What does it do? It stimulates angiogenesis. More blood vessels growing. Guess what? Not only is it healing the wound, repairing the wound, but the other thing that it's actually doing is that it's also helping to restore the nerve function as well. And nerves will grow back. Nerves will grow back if you allow them to grow by eating the right foods, by not killing the nerves some more. Nerves grow back about 1 millimeter a day. That's about a millimeter right there, okay? A tiny bit, then the next day, then the next day, and the next day. You can actually grow nerves back pretty quickly, all things considered, all right? So the warning sign we're talking about here are chronic non-healing wounds that might be on your foot. You should always check your feet. If you've got diabetes, before you go to bed, you should, cross your legs, look at the bottom of your foot on the right, take a look at the bottom of your foot on the left, check around your ankles, make sure there's no wounds. And if you're actually taking a shower, that's another example, another opportunity to be able to take a look at your skin on your foot and also keep it nice and clean. All right, soap up your foot. That's actually a really important little tack, I would actually say, in order to be able to avoid the problem. But if you actually have a non-healing wound, time to see a doctor, all right? You're probably going to need to be seeing a wound specialist, somebody who works in the wound clinic, but don't be afraid to advocate for yourself and ask your doctor to refer you to a wound care center, all right? They're around and they have all the technology, all the tools, hyperbaric, living skin equivalents, growth factors, all kinds of different things. Most importantly, the experience of actually getting a wound to actually heal back up. If you don't, I'm just telling you, these wounds will get worse and worse. They'll get infected. Your immune system in diabetes is also lower. So now you've got poor blood vessels, poor nerves, and now you got an infection and your immune system's also down. This is why diabetic foot ulcers are a common reason that doctors wind up amputating the feet and the legs of patients who have these chronic wounds. So you don't want to be there. Trust me on this one. All right. So that's the second warning sign, which would be actually a wound on your foot that doesn't heal. All right. Now, telltale sign number 3, major swelling in your feet and ankles and into your calves. Right. And you've probably seen this, recognized this. I mean, you've seen somebody, maybe they're on a bus or in a subway. They might even be on a plane, maybe on a beach, but somebody who's got, really, really swollen calves and ankles and foot, and the foot is sort of kind of like pillow shaped, really, really swollen, and it's actually filled with fluid. Now, swelling in the feet can actually happen for a lot of different reasons. All right. Some of the reasons that are harmless are, for example, if you're on a long plane flight, say you're flying across the country, flying across the ocean to Asia or Europe, you're sitting there for a long time, and even though an airplane has a pressurized cabin, they artificially put air pressure in the cabin. It's a lot less than when you're actually not in an airplane standing on the ground. All right. So with lower cabin pressure compared to what is on planet Earth when you've got your feet on the ground, less pressure means that the water inside your body can seep out under the skin, not through the skin, under the skin, from your blood vessels, out into the tissue, out towards